Welcome back. On a day earmarked to celebrate America's independence, this July 4th, President Trump signed a bill into law that has a major impact on low-income families, their ability to access affordable health care, and now feeling the residual effects of this law as an essential health care provider in the Bronx and throughout the country. Planned Parenthood of Greater New York. And joining us to discuss how this bill will impact her organization, please welcome Vice President of Communications and Marketing at Planned Parenthood of Greater New York, Jacquelyn Marrero. Jacquelyn, welcome to the show.
Dr. Bobley, thank you so much for having me here today.
It's all over the place. You see a lot of people come on TV and they talk about it. They're being interviewed all over the place. And it has a major impact. Begin to tell us some of the things that you're doing and going through and preparing for.
Sure. The bill that Congress passed and has since been signed into law by President Trump is devastating, dangerous, and quite frankly, a direct attack on individuals and families who are already struggling to make ends meet, as well as access abortion. So the provision in this bill, or now law, was intended to strip Medicaid from millions of Americans, including more than 100,000 New Yorkers who rely on Medicaid to access care at Planned Parenthood of Greater New York health centers, including the center right here in the Bronx. It also directly targets Planned Parenthood patients by defunding our organization out of the Medicaid program. What I mean by that is it denies Planned Parenthood reimbursement by the Medicaid program for services that we provide, for most of the services that we provide. I'm talking about wellness exams, cancer screenings, birth control, STI testing and treatment, HIV prevention like PrEP and PEP, which are life-saving medications for people living with HIV. They're doing this all to punish us and our patients because we also proudly provide abortion care. Although federal Medicaid does not apply to abortion services. So let's talk about who this really impacts the most, right? We're talking about people who already face great barriers to health care due to systemic injustices, economic inequality, gender bias, racism. We're talking about mothers who already deprioritize their health care to put their families or their children or their husbands first. We're talking about young folks who maybe rely on Medicaid while they're searching for employment with benefits. And we all know how hard that could be nowadays. So in July, a federal judge found that this law was unconstitutional because it singled out Planned Parenthood and the judge issued a preliminary injunction blocking the enforcement of the provision, which continues to allow Planned Parenthood to receive reimbursement for the services that I had named, at least for now. But we can't lose sight of what's really happening here, right? This provision and this law, this spending bill or law, is deeply unpopular. It's deceptive and just outright cruel. The consequences are going to be incredibly clear. It's going to be cancers that are going undetected. It's going to be STIs that are going to be untreated. Patients are going to lose access to birth control and abortion care. Health centers, specifically Planned Parenthood health centers, could be at risk of closure. The hardest hit are going to be Black and Brown communities right here in the South Bronx, where I call home, LGBTQ plus folks, families and patients with low incomes, and people in rural areas of the state. And just to put this in broader context, all while giving tax breaks to billionaires. The spending plan is the most significant transfer of wealth to billionaires on the backs of healthcare.
And in a statement, Planned Parenthood called the law a backdoor abortion ban. Connect the dots for us.
Absolutely. So defunding Planned Parenthood was a deliberate attempt to punish abortion patients and providers. The language in this law specifically excludes Planned Parenthood, it names Planned Parenthood, in abortion access states like here in New York, where we know abortion is codified into our state constitution. More than 50% of our patients use Medicaid to access our care. In a state like California, 80% of their patients rely on Medicaid. By defunding us out of that program, it puts our health centers at risk of possible closure. And we're proud to be one of the largest providers of sexual and reproductive health care and abortion care, along with education and our advocacy work.
Yeah.
What this administration is trying to do is starve us of one of a critical revenue stream that goes directly back to the communities that we serve, all to block access and strictly
Mhm.
limit access to abortion.
What should your patients on Medicaid know if they need to access health care at PPGNY?
Well, first, care continues here. If you need health care, sexual and reproductive health care, if you need abortion care or gender affirming care, you can absolutely book an appointment. Visit our website at ppgreaterny.org. Call us at 1-800-230-PLAN and book an appointment. We have an incredible health center here in the Bronx, which was recently
Mhm.
modernized so that we are reaching the population of people who need us the most. So care continues.
Yeah,
That's the first thing I want folks to know.
yeah,
If you have Medicaid or any insurance or uninsured, you can also access our health care. We're not going to allow this administration to fully impede our ability to care for the communities that we serve.
mm,
And we're going to use everything in our power to do as much as we possibly can for as long as we can.
yeah. I
So that's
see.
what I want people to know.
Yeah, I see the vehicles, the big vehicles traveling through the streets and sometimes parked at health fairs and things of that nature. Here in the Bronx, what kind of reproductive and sexual health challenges do you see most often with young adults, especially in the summertime?
Sure, that's a great question. I think the vehicle that you're referring to is Project Street Beat, which is one of our oldest HIV preventative
Hmm.
care modalities and programs. Our PSB or Project Street Beat has been around for quite a few decades, and I believe has greatly contributed to the reduction of HIV in our borough and perhaps even in our state, which we know the Bronx, specifically how the South of Bronx, has for way too long been one of the most unhealthy congressional districts in America.
Yeah,
What kind of healthcare provisions we offer and see amongst young people? I'll say this: young people must be educated on sexual and reproductive health care. And we are advocating for comprehensive sex ed in schools, and we provide those services as well. So people know not only about how their body functions and what healthy sex looks like, but things like consent, which are incredibly important,
yeah,
and directly help reduce the rate of STIs in our communities.
yeah. Where do you start, in junior high or high school?
Well, we believe in comprehensive sex ed K through 12, right? And that is offering age appropriate sex education.
Yeah.
So someone as young as kindergarten knows the difference between good touch and bad touch, right? That's age
Hmm.
appropriate.
Yeah.
And then as you get older, you begin to learn more, as most of us, probably not many of us, learn in high school.
Hmm. Yeah. So, who is most directly affected by these challenges you face in maintaining these services?
Well, a majority of our patients, like I said, rely on Medicaid. So we're talking about families with low incomes,
Yeah.
people who are struggling to put food on their tables, right? We didn't even really dive into how this spending bill also drastically limits access to SNAP. These are families who are gonna who are literally hungry,
Hmm.
right? And probably deprioritizing their access to healthcare. We're also talking about individuals in the LGBTQ plus communities or trans individuals who, quite honestly, have a hard time navigating the employment landscape.
Yeah.
They're going to be directly impacted, along with people who are in Black, Latinx, and Indigenous communities who often have been deprived of access to affordable, quality, and quite frankly, compassionate sexual and reproductive health
Yeah.
care. And I think I just described a huge population in the Bronx. And so we know
Yeah.
that the Bronx will be directly impacted by this. And we're doing everything we can to keep our doors open.
Yeah. How many doors do we have? How many healthcare centers does Planned Parenthood have in operation now in the New York City area?
Sure. So in the New York City area, we have four health centers. We also have our virtual health center, which allows
Mm-hmm.
people to connect with a provider from wherever they feel safe. Maybe that's home. Maybe that's in their car, right? Maybe it's at a friend's house, but it allows them to access care with a provider no matter where they are in the state.
Yeah. People are not feeling the effects of the bill that just went through. But what do you tell them to prepare them for it?
Yeah, that's a great question. We know that the devastation of this bill is going to be long lasting. And what I tell people to do is begin to act now. Begin to, if you have the power to organize, if you are in a position where you have a certain level of privilege or resources, gather your friends. Host a fundraiser, right, for Planned Parenthood and for patients to access our services. Something my family and I like to do at our home in the Bronx is host bingo nights, where we raise money and funds for various charities.
Uh-huh.
Go on our website, get involved. We have a get involved button so that and once you visit that site, you'll see a petition to Governor Hochul and our reproductive champions in Albany. Sign the petition asking for state relief should Planned Parenthood be defunded by
Yeah.
the federal government.
So you're in hopes of getting funded statewide and also privately by holding these little like fundraisers on the side. So it's going to
Well,
take community-based organizations, CBOs, and nonprofits to help continue these efforts.
absolutely. We are part of an essential healthcare ecosystem, right? A recent study found that Planned Parenthood is irreplaceable in the communities we serve. And we're really proud to be part of an ecosystem that focuses on the health and welfare of all New Yorkers, specifically centering those who have been pushed to the margins of society due to various economic and social injustices. And we must continue to center those communities.
Yeah.
Philanthropy has always been a way to support our patients and their organization. However, we need sustainable funding. And that comes from the federal government, which we know we can no longer rely on. And now we are turning to the state to help
Yeah.
provide financial relief should we lose that critical funding from the state and Medicaid.
Jacquelyn, you want to give a shout out to some of the staff that are working with you to help make all of this happen in our
Oh, thank
communities?
you so much. Shout out to everyone who's working at the Bronx Health Center today and every day, from our providers to our front desk staff. Shout out to the educators and community organizers and activists who go out into community with their sexual and reproductive health care kits, and they're showing people, how to educate themselves about their bodies and consent, and all the people who are really doing a lot of the hard work when the federal government is telling us not to. We know that our existence is an act of resistance.
And for more information, they'll go where?
You can visit ppgreaterny.org.
There you go. Jacquelyn Marrero, Vice President, Communications and Marketing at Planned Parenthood of Greater New York. Thank you so much. Thank you
Thank
for
you.
sharing. All right, we'll take a quick break right here, but wait, we'll come back. We've got some more open coming up next.